So my name is Mollye Demosthenidy, and I'm a clinical assistant professor here in the department. My background is actually in law and policy, and I teach 4 different courses here. I teach health law and regulation, I teach healthcare policy, I teach an ethics course, and I also teach an introductory survey course that looks at health systems and the management of those systems. And sort of underlying all of the courses that I teach is really this idea of how people and government can, through law and policy, affect substantive, positive change in our healthcare systems. So over the past few years, and probably the past few decades, healthcare has really emerged as one of the most pressing issues facing the United States. And I think we face a number of challenges in the way we deliver healthcare. First, how do we lower the overall cost of healthcare services to the population? How do we improve the quality of those services? How do we give more people access to public health and healthcare services? And really, how do we improve the quality of life that everyone in this nation enjoys? And I think at times those challenges can seem really daunting. And when I approach my students with them, I don't want them to be frustrated, and I don't want them to be afraid. I want them to be excited. I want them to realize that we can do better, that there are solutions out there, but it's going to take a new way of thinking. It's going to take collaboration between public health and the medical care delivery system. It's going to take application of new ideas to solve these problems, but it's doable. And I think that's what we're doing here at Tulane. So the best piece of advice that I give prospective students is to make the most out of your time here at Tulane. A year and a half to 2 years goes by really quickly, and I think it's important that you plan out your courses, you have an idea of what it is that you want to get from your degree program. And that you walk away with that. But in addition, that you get to know as many professors as possible, that you get to know as many of your student colleagues as possible, that you make network connections that will help you in your career, that you get exposure to all of the projects that are going on here at Tulane. I think it helps broaden your perspective, and it will ultimately make you a better public health professional when you leave us here.